Much better. Much better. Remember I was saying
Yeah.
that?
Go ahead and then tell me exactly what's going on with you and then why you came to see me here today.
So, I have so many problems in my body. First of all, I have problem with my ankle, right ankle.
Okay. How long did you have a right ankle pain for?
For about 6 months, I got injured by playing soccer and it's not going away. It's always bothering me when I run, walk, or like stress my leg. And then I have another problem with my shoulder.
Okay.
Like neck, neck area, shoulder area. I drive for a very long time whenever I'm sitting for too long and looking straight, that bothers me. I had lower back pain before, but it's not bothering me right now. It went away.
And then your lower back pain, how long did it really last you? So when did it occur and then when did it get resolved?
So my lower back pain, I got it last year.
What kind of doctor did you go to?
Chiropractic.
Okay, you went to chiropractor, yes?
Yeah.
How many treatment did you have for your lower back?
3 times.
3 times.
3 times, and then he told me to do some exercise at home. I did that, and it went away.
And then the ankle pain. Did you have the ankle pain when you were seeing the chiropractor or no?
No, I got it afterwards.
You got it afterwards.
Yeah, so like about.
So what type of movements is bothering you a lot? Because I want to be able to do before.
By sitting.
Sitting right now when you're sitting, you have a lot of uncomfortableness. Yes.
I have uncomfortableness. Yes.
Right now.
Yes.
Okay.
I guess
before we go ahead and then examine your foot and ankle, that actually leads to all the other problems. So let's just go ahead and then see exactly what the differences are. So before I go any further, I want to be able to let you know that if you have problems in this area for such a long time, you start to have degeneration of the muscles, which means that you start to lose muscle mass. And that can happen with somebody who has a problem for a long time. So what I'm going to do is I'm going to go ahead and then measure you just a little bit. So if I measure your thigh just right above your knees, I'm going to go and turn it around here. It's at 13. You can see it's at 13, yes? At this time, if I actually measure right here, it's actually 12.8. So which means that you're right. So this is about 0.2 millimeters smaller. Which means that there's a little bit of degeneration of the muscles on this side.
Okay.
Does it make sense to you?
Yeah.
I want to be able to also measure just right below the knees right here. It's exactly at 13. And if I do this side right here, this side is actually 12.6. 0.2 millimeters, I'm sorry, 0.2 inches smaller over here. 0.4 inches smaller on your calf area.
Gotcha.
What that means is you actually have lost about 0.2 inches of the muscle mass over here, and then 0.4 inches of the muscle mass over here due to chronic problem. Now you have told me that your ankle pains are only going on for 6 months, but in order for you to be able to lose muscle mass this much, this means that you probably had a problem for a long time. You said that you had a soccer injury that actually caused your pain to have your ankle. I think that what may have happened was that your leg problem was chronic and it was getting worse and worse. Your ankle injury through your soccer games are probably what they like to call last straw that actually broke the camel's back. Does it make sense to you?
Yeah.
So it was just kind of waiting to happen, and then this ankle injury was exactly what was actually going on with that.
Yeah.
Does it make sense? I told you about the muscle degenerations over here and over here that has been going for a long time. This actually happens because the nerve functions coming from your spine all the way down to your feet are compromised. So whatever it may be, how we can actually tell this, how we can actually confirm this is that if there's a weaknesses of your leg and your thighs and your feet and your toes. Because the same nerve that comes out from your lower back area goes to your thighs, to your leg, and then also down to your feet. So if there's some kind of weaknesses, that tells me that there are some kind of dysfunctions above somewhere. Does it make sense to you?
Yes.
As you can tell, you cannot really push this down over here. I want to let you know, this does not happen in 6 months like this.
Yeah.
That much of weakness, you see how visibly different it is. That does not happen so easily in 6 months. Just want to let you know about that.
I have for like a long time.
A long time. You have to get this for a long time, my friend. Go ahead and push this back. Push this out. That's strong. You cannot draw back.
Yeah.
Once again, I'm going to use 2 fingers again. Even then, you cannot really draw back. That's how weak it is. Both of your left thighs and thighs and legs are very, very weak in the back. Both of your second toes are actually very weak. Do you notice this?
Yeah.
That's weak. Fourth toes are weak, and fifth toe, my God, very weak. These three nerves, the nerve that goes to back of your thigh, back of your legs, as well as your feet over here, those are actually coming from the tailbone, sacral area, the bones you're sitting on.
Okay.
The reason why you're feeling uncomfortable when you're sitting are the same reasons why those three things actually hurt you. Does it make sense to you? I'm going to go ahead and examine your spinal areas right now.
Okay.
Before I go any further, I can already tell that there are a lot of stiffness in your lower back area.
Yeah.
You see, this is actually really, really tight. It's almost like me, touching a something that's actually very tight. I really cannot think of any kind of a analogy for it, but you see how tight this is?
Yeah.
Extremely tight. That usually happens when there are some kind of structure and stability.
Gotcha.
All this, you see how this is actually different from over here?
Yeah.
This, I can actually push it in. It's plump. It actually goes in. I cannot do anything like that over here. That tells me there's some kind of instability going on over here. More importantly, when I'm actually touching you over here, I can also see that there are a lot of swellings. You see, it's actually kind of goes pretty deep. Also, almost feels like a watery. You feel this, right?
Yeah.
This is what we like to call swellings or edema. That means that there are extra amount of fluid in your body staying here to keep the structures to be stabilized. Your muscles are tight. Your body is reserving extra waters or fluid around this area to keep this area as stable as possible. That's exactly what it means.
Gotcha.
Does it make sense to you?
Yes.
Me just running the scope through my spine, scope through your spine, I already found a couple of problems, a couple of readings over here. I actually found the reasons why you actually have a lot of pains in your knees.
Gotcha.
I'm gonna go and write that slightly more. And then guess what? I did find your tailbone problem that you have problem having sitting on. I also found that also. Thank you. So I'm gonna go and rock you back and forth. So this 5, 4, 3. How's it right here?
Good. Oh, right here.
Right here, right here,
Yeah.
right?
Yep.
Right here.
Right here. Yep.
Should not be so painful right here. Yeah,
Little
this.
bit into this.
Yeah. How's it right here? Pain? If I go here like this, you see how it's not moving here at all?
Yeah.
This is pretty painful over here, yes?
Yes.
Yeah, right here.
Right here.
Right here. So this is your spine from front to back. This is your spine from side to side. You see your spine is not really straight. It actually goes kind of curves to the right side and it stops and it curves to the left side and it stops and it kind of stacks up from the middle part of your back and then go all the way up. You see that also,
Yeah.
right?
So messed up.
This right here, as you can see, right here, this is your tailbone. Right
Yeah.
here. Your shoulder, all the other things falls onto this tailbone right here. You already have told me that it's not really straight. In fact, it's just kind of tilted toward this side. You can actually see that too. That actually coincidentally is a sitting bone. It's a bone that you sit on. Also, on top of that, this is the same bone that actually is responsible for supplying nerves to the back of your calf and back of your thighs. That actually is all related to it. Moreover, it also nerve supplies to your second, third, fourth, and fifth toe where you had problem before. So all your problems are actually pointing to dysfunctions over here. You see small circles over here? Circle,
Yeah.
circle. You see this one, the first foramen of the circle number 1 is actually pointing more this way. And then it kind of switches and it kind of points toward the left side. First one right side, second one left side, this one also left side, this one left side. There's a small lump that came between the first and second. You see that, right? It's pointing this way. This one is kind of pointing this way. So there is definitely some kind of a dysfunction right here, right in this joint, right up top. And coincidentally, that's exactly where you had pain when I was. This is your right ankle.
Yes.
Arm is right. This is your leg bone. This is your ankle bone, and this is your foot.
Yeah.
So this is your foot and ankle X-rays. I want to be able to let you know there is no broken bone, there's no problems that actually have found it to be problematic. There are slight amount of this misalignment that I've noticed on your talus, which is one of the biggest ankle bone right here, to be problematic. They found some problems to be in your cuboid, right? This is a bone that is the closest to your back of your heel, that's closer to your ankle because of your ankle problem. But otherwise, it's pretty uneventful. So when you actually had a foot x-rays done, your doctor and then radiologist said there's nothing wrong with your ankle. That's exactly what they mean.
Yeah.
They did not find a lot of problems in your ankle, and guess what? Because that's not where your problem lies. Your problem of your ankle, yes, you do have some muscle problem from soccer injuries, but this problem right here is not really what's actually screaming at you. Your problem in your right ankle is secondary to your tailbone problems, the structural problem coming from your spine. That's how impactful your spine functions are for your foot and ankle. And that's the reason why actually I'm making this video, so that I can tell you and other people, you don't have an ankle problem, you actually have a spinal problem causing your ankle. So stop trying to make a small thing out of a big thing. This, your ankle, slight amount of problem, maybe about 25% of your problems are coming from over here.
Gotcha.
Rest of it coming from your spine.
Right here. Oh.
Okay, let it down. Let it down. Let it down. There we go. I'm going to unroll. You're not going to talk. You're not worry about it, okay? There we go. That's it. So what I'm going to do is I'm going to pump this joint. Right here is called talus. And I'm going to. You felt that?
Yeah.
Can you go up just a little bit? There we go. So I also found a problem in your cuboid, so I'm gonna go ahead and pump it and then push it from bottom to top, like this. Okay. How much of the pain has disappeared just by you doing that right now?
A lot. I don't know how much, but a lot.
A lot, right?
Yeah, like a lot, yes.
Can you quantify that or not really? Can you put a number on so that I can track on how much you get better on visit by visit basis?
Okay, so look, before I couldn't do this.
Yeah.
I used to feel pain. But right now I could do it.
Yeah.
I don't feel as much pain as before. Much better. Much better. Remember I was saying
Yeah,
that, you know?
have a seat, have a seat.
Much better.
Have a seat. Do you have any discomfort? What does it feel to you?
Feels good.
Feels good?
Yeah.
Do you have any discomfort when you're sitting?
No.
Do you feel relief in your lower back pain?
Yeah.
How much of your lower back pain has gone? 0 to 100%.
Wait, hold up.
Now, if I did my job and then fix you properly, you are going to feel differences. You're going to see the difference in terms of strength. That tells me exactly how much of it we actually restore. Does it make sense to you? Yeah. If I did my job, the weakness in your left leg should be better. Does it make sense?
Yeah.
So without further ado, let's try this. Take your hands out from your pocket. Push up. Strong. Push up. Strong. Push down. Strong. Push down. Look at that. Push out. Push it in. Push out. Push it in. Wow. Isn't it? You're smiling because that's pretty amazing, isn't it? But you know, 3, 4, and 5 was all weak, especially the 5th one. You remember that, right? Push up, push down, stronger. It's almost the same. Isn't that crazy? It's almost the same. Everything's the same right here. But what I'm trying to tell you is your ankle pain is not entirely due to your right ankle problem. It's also because of, guess what? Your spinal problem. I was able to take away at least more than half of your ankle pain just by me treating your spinal pain. Yeah. And that wasn't even painful area at all. You told me you don't even have a back pain, but guess what? That's actually better. Does it now make sense to you?
Yeah.
Yep. And then look, you're also sitting straight because I just improved your biomechanical structure.
I feel like I'm sitting straight.
Yeah, see?
Before I was sitting on